Starting with the etymology of pain, because this comes under the category of pain management. Pain is, the Middle English etymology says that it is suffering inflicted as a punishment for an offense. So even today, pain is considered a punishment for some offense. But I think we also have our own affiliations to pain, because it is our guide to so many things. What we don't want is the unwanted pain, the unnecessary pain. To the person having a toothache, even if the world is tottering, there is nothing more important than a visit to the dentist. So I'm here to talk on this, on two of the major maladies the orthopedic surgeons face today is osteoarthritis and rheumatoid arthritis. And I think the whole world knows that as far as cure is concerned, there's no cure. It's only a question of getting it under control. The rheumatoid arthritis is a systemic disorder characterized by a chronic inflammatory polyarthritis of unknown etiology. The inflammatory state also involves the skin, eyes, lungs, and blood vessels, fluctuating clinical course and unpredictable prognosis, with a very high 60% increase of cardiovascular disease and related death. The pathophysiology is something which we all know about, but just for a quick recap, we have the macrophages, which are attacked by the antigen carrying cells, which in turn releases the inflammatory cytokines from macrophages, that is the tumor necrosis factor alpha and the interleukin 1. These lead to synovitis, production of collagenases, and leads to destruction of the extracellular matrix. The releases of the metalloproteases leads to cartilage degeneration. And in a very broad perspective, it's the same pathophysiology which brings about the cartilage destruction even in osteoarthritis. It is the same tumor necrosis factor alpha and the interleukin 1, which are involved as major cytokines involved in the pathogenesis of OA. Cytokines are basically small protein molecules which help one cell to communicate with another. The TNF alpha and the IL-1 are the major inflammatory cytokines involved in rheumatoid and RA and OA. Release of these cytokines, the release of these products, the TNF alpha and interleukin 1, are what that causes the synovitis and the damage to the cartilage. And this release is regulated by the nuclear factor kappa B, NF-κB. NF-κB is a transcription factor present in all cells. So these cells in the macrophages are then they give the code to release the cytokines. The NF-κB acts as a master switch to turn inflammation on and off in the body. The disorders due to NF-κB activation are RA, OA, ankylosing spondylitis, psoriatic arthritis, juvenile arthritis. So that's how the activation of NF-κB takes place. There is an inflammatory stimuli. There is a tumor necrosis factor alpha and the interleukin 1, they come out. There is activation of NF-κB. Then there is translocation of this activated NF-κB into the nucleus. And then there is activation of the genes encoding the inflammatory mediators, that is the cytokines. The outcome of NF-κB activation continues to the end stage of the disease, which includes synovial irritation, chondrocyte cartilage destruction, and bone erosion and bone destruction by osteoclastogenesis. So the current opinions, the problems with the current drugs are that they are not suitable for elderly patients, the NSAIDs, and they are not safe for long-term use. I think as far as the pain factor is concerned, we have got a good control of pain. The problems are the side effects. Steroids, of course, all universally known, not advisable for long-term use. The gastritis, ulceration, diabetes, hypertension, osteoporosis, and increased risk of infections. As far as the rheumatoid arthritis are concerned, We have the DMARDs, which are slow in action, take several weeks to show their effects and provides a very partial response and very erratic response sometimes. There is a loss in efficacy with continued use and needs close monitoring for adverse effects, which could include bone marrow depression and things like that. We have biologics now in a big way, but they are very costly, they are very expensive, and they target only a specific inflammatory mediator. There are injection site reactions and there are increased risk of TB or demyelinating diseases and cancer. So that's what the innovative option for management of arthritis took place. It was curcumin. Curcumin is actually the active ingredient which is the most active part of the haldi, the turmeric that we use. It has always been history that newer drugs are found through folklore many a time, and the active ingredient is caught and then it is purified to such an extent that it can be used as a drug. So curcumin is biologically active. It's basically a phytochemical obtained from the rhizomes of Curcuma longa, and it possesses anti-inflammatory, antioxidant, anti-proliferative and anti-angiogenic properties. It is basically a NF-kB inhibitor, and that's how it prevents the release of cytokines and thus preventing the damage caused by the NF-kB. So it inhibits IKB kinase enzyme, prevents the activation of NF-kB. It prevents translocation into the nucleus and therefore prevents the release of the inflammatory mediators. The role in RA and OA shows that it can be used in conjunction with the anti-inflammatory agents, in which case it may decrease the use of the dosage of the anti-inflammatory drug. It is the pilot study. What we need to know right now is that since it's not exactly a drug, it does not come very much under the purview of the drug control. This thing is still classified as a nutraceutical. There are, as far as I know, there are no double-blind clinical trials of a large series. You can correct me if I'm wrong, but as far as I know, there are no phase 3 clinical trials done on this drug, but this compound. I don't know whether it will be classified as a drug because it is still a nutraceutical. But the advantage with this is it has some effects of anti-inflammatory effects for our osteoarthritis and rheumatoid arthritis. And the plus point being that it is extremely well tolerated and it is it's fairly safe. There have been some studies, 820 OA patients with curcumin for 6 months, and they have had good relief of pain. There is a comparison of curcumin and ibuprofen, and both show more or less a similar range of analgesic properties. The winning point comes to be the safety factor. There have also been studies on curcumin monotherapy, that is curcumin used alone without any anti-inflammatory drugs, and they have also found to be very positive. There is a combination therapy of curcumin and diclofenac, and these are all studies, but they still to undergo the acid trial of the phase 3 clinical trials. So when given with celecoxib, it decreases the need for celecoxib. Curcumin, when given with prednisolone, gives a reduction in joint swelling, reduction in side effects due to steroids. When administered with methotrexate, it has a synergistic anti-arthritic action. Safety, it's generally found to be very safe. There are some gastric intolerance problems. Sometimes they are allergic to curcumin. There might be mild or transient nausea or vomiting. And it's supposedly free from adverse effects on kidney, liver or cardiovascular systems. So the conventional curcumin is undetectable in plasma, a hydrophobic polyphenolic compound, and it is poorly absorbed from the GI tract. So the problem with the turmeric part of it is that they are not they're not very absorbable salts. So now what these people are trying to come up with is a self-micro-emulsifying drug delivery system which enhances the absorption of curcumin, and so you need to take lesser amounts with more being bioavailable. So these are some graphs which show all those things, that they are essentially more bioavailable. Their place in therapy, it's an attractive option in the management of rheumatoid and osteoarthritis, either as monotherapy or combination therapy. It is particularly useful option in these group of patients which are intolerant to NSAIDs, steroids or DMARDs, compromised renal function, hepatic dysfunction, cardiovascular distress, hypertension and CHF, because these are drugs which have to be given for a long period of time. Curcumin, just for the sake of information, is also used in arthritis, Alzheimer's disease. In fact, they say that the decreased, the lesser incidence of Alzheimer's disease in India is because of the extensive use of turmeric. Uveitis, irritable bowel syndrome, acne, psoriasis, atherosclerosis, cancers. Today, everything from common cold to cancers. Finally, for all the happiness mankind can gain, it's not in pleasure but in relief from pain. So this is one of our many compounds we have in our armamentarium to fight. Maybe this will take some time before it undergoes all the clinical trials. But one thing is for sure, phytochemicals are here to stay. So let's respect them, let's give them a patient hearing, and let's try it out with our minds open. Thank you.